Okay, well, we're going to talk today about cholesterol. Is that correct?
That's correct.
Okay, so is this Dr. Karol Watson?
This is she, yes.
Okay, Dr. Watson, why don't you start us off by telling us what you think is the important thing for us to discuss about cholesterol fluctuations and the relationship to heart disease, heart attack, and stroke.
Right. So many of us have heard of cholesterol, but we don't really have an idea of like what it is. Why is it there? So cholesterol is just this waxy, fatty substance that's in all of our bodies, and it's very important because it's what we use to make all of our hormones like estrogen, progesterone, etc., and all of our cell membranes and keeping our skin plump. So it has some very important functions in our body, but the amount of cholesterol you need to perform all of those functions is very low. Anytime we get more cholesterol in our bodies than we need just for the basal functions, everything that's in excess can deposit places we don't want it to. So it might deposit in the vessels that take blood to our heart. That can cause a massive heart attack if those vessels get clogged with cholesterol. It might clog the vessels that take blood to our brain. That can cause a massive stroke if those vessels get clogged with cholesterol. So that's why we physicians pay so much attention to cholesterol. We know it's important to have a certain low level, but anything above that can start to wreak havoc with our heart.
Okay. And Eliz, I understand you've had trouble with cholesterol?
So actually, when I was 35 years old and 7 months pregnant with twins, I had a heart attack. And fortunately, had great care right away. I'm doing well. My girls are 17 and doing well. But what that did for my health is since I've already had a heart attack, I'm at great risk of having another one. So I do everything I can to limit my risk of that happening again. So I pay attention to my blood pressure, my stress, my cholesterol in order to prevent that. And I'm really on a mission to make sure that other people do the same thing, which is why I am so delighted to be partnered with Koa Pharmaceuticals America on this education campaign, Take Cholesterol to Heart. And it really is dedicated to make sure that people understand why managing your cholesterol is important, but also one of the things that we discovered that is that when people are prescribed a statin, half of them stop taking that statin within the first year without talking to their doctor about it, which is really dangerous. We want to make sure that people talk to their doctor before they stop, because there are options.
Okay, now, Dr. Watson, why do people stop taking the cholesterol, the statins? They're called statins, right?
Yeah, exactly.
Okay, now why do people stop taking them during the first year?
So most of the people, I think, don't really understand how strong the relationship is between their high cholesterol and a heart attack or stroke. I think if people understood that this statin medication is not just to lower the cholesterol number, but to prevent heart attack and stroke, they would be much more cognizant about taking it. Another reason might be that some people get side effects from their statin. And so instead of, pursuing, discussions with their doctor, they say, oh, just stop it. And they don't even tell their doctor. So I think those people need to understand that we gave you this medication because we believe you're at risk and we want to lower that risk, and you can't get benefit from the medication if you're not taking it. And there are many different statins out there. So if one of them didn't work for you, or you think it caused a symptom or side effect, talk to your doctor. I'm sure they can find a different one that might be better for you. Just talk to your doctor. Don't just stop your statin.
Okay, are there certain symptoms that people have that make them want to stop?
So most people will tolerate a statin very, very well. They are very well tolerated and safe medications. Some people complain of symptoms like muscle aches and pains sometimes. Some, there are a number of things people might complain of, and some of them may be related to the statin, some of them maybe not. But what we need people to do is have that discussion with their doctor to figure out what they think really is related to the statin and what's not. And on the website, takecholesteroltoheart.com, there's a really nice discussion guide to help you frame those questions with your doctor, to help bring them to their attention so you can have a good, fruitful discussion.
So now let's talk about this website again. It's takecholesteroltoheart.com?
Correct.
Okay, that's good to know. Well, I really enjoyed talking to both of you today, and I'm sure the information that you're sharing with me is going to be very helpful for my Health Power audience.
Well, wonderful.
Thank you so much for having us.
Thank you, Dr. Witt.
Okay. Okay, and both of you take cholesterol to heart.
Absolutely.
You will.
All right. Have a good day.
You too.
Thank you.
All right.